Singapore's community cases of COVID-19 have crossed the 1,000 mark for the third time in 4 days, numbers that we last saw in April of last year. Over 1,000 cases are currently warded in hospital as well.
Now joining us to make sense of these numbers is Professor Tiki Pangestu, a visiting professor at the Yong Loo Lin School of Medicine at NUS. Professor, besides the 1,000 plus daily cases, what other numbers should we be concerned about, if at all?
Thank you, Steve. Obviously, the 1,000 number is a worry, but I would say there are other numbers that we need to sort of be looking out for. The first one is how many people are still unvaccinated, especially amongst the old. Secondly, the percentage of those vaccinated who have serious side effects, like, blood clots, cardiac arrest, myocarditis, allergic reactions. The third number is obviously, very importantly, the number of hospitalized cases, especially the severe cases that end up in ICU on a ventilator. And obviously, you've got to keep track of the number of deaths. The fourth number I think we need to keep track of, on the flip side, is the number of mild cases and those that have recovered, on the flip side of the severe cases. And finally, at the community level, the number of active clusters, especially if it happens in old people's homes, for example. So those are just 5 numbers in addition to the daily case numbers.
Professor, as we continue to gain evidence that this virus is moving throughout the community, when do you expect Singapore to reach the peak of the current wave, and how likely are we to reach that possible 3,200 daily case number?
Dawn, that's a bit difficult to answer. The peak, I think it's hard to predict. It may be affected by whether the government imposes additional measures. It can be affected by increase in the number of vaccinated people. It can be affected by how many people are actually being tested and are asymptomatic. In terms of number of cases, I want to quote my esteemed colleague, Professor Alex Cook at the Saw Swee Hock School of Public Health at NUS. And Alex says the doubling time at the moment is about a week. Okay, so he's sort of like forecasting that Singapore will have 2,000 cases in about 1 week. And, by that kind of modeling, maybe 4,000 cases in about 2 weeks' time. But as I said, that's just a forecast. It can be affected by those factors I mentioned previously.
Now, Singapore will ban visits to hospital wards for 4 weeks from this Friday to preserve hospital capacity. But if we are to live with COVID, why the need for these measures?
I think, Steve, the main reason for that is, with the surge, there have been increase in cases amongst hospital staff, amongst patients, amongst visitors. And if hospital staff, doctors, nurses, end up getting COVID, okay, they're going to have to quarantine. Some wards may need to be closed, okay? And, that will then affect the capacity of hospitals to deal with severe cases. I think the other reason, of course, is that hospitals are environments where you have many vulnerable people, old people, people with serious illnesses. So, once again, reducing the number of potential spreaders would be also, I think, a good conservative measure.
Professor Pangestu, we've reached a stage now where home recovery is the default for most people who've been infected with COVID-19, but it's not easy for everyone to understand just what to do, despite the guidance that's been given. Is there a chance at all that this program, this home recovery program, could even worsen the community spread, given how tough it is to ensure that households kind of stick to the protocols?
Yes, I did see a news item on CNA today that says that people are worried there's not enough guidance. My quick answer to your question is that I think it's unlikely that it's going to make things worse, simply because, the spread of the virus is basically already unstoppable. It's already out there. So whether you promote home recovery is not likely to make things worse. It's already out of control, put it that way, the spread of the virus. And I think the issue of home recovery is you need to sort of get a balance between mild cases recovering at home versus the need to ensure that you have hospital capacity for the more serious cases. You can't just have everyone going to the hospital for the mild cases. So you got to get that balance right.
And vaccine take-up rate has plateaued at around 82%. Will mandatory vaccination now be the way forward, or should we rely more on booster shots?
Steve, I think the issue of mandatory vaccination is very complicated and can be quite controversial. It's a tough decision to make. From a public health perspective, I would say mandatory vaccination is probably important, to protect the entire community. And you already know that in Singapore, for example, if your child is not vaccinated against the common childhood preventable illnesses, that child cannot be enrolled in school. So there is a precedent, but there are issues related to individual, human rights, the right to choose. There are medical reasons for people not being able to receive the vaccine. Some people may also even have religious objections to receiving the vaccine. So it's tough. It involves not just public health, but moral, ethical, even legal issues. My own view of this is that before we go that route of mandatory vaccination, why not think about incentives? Now, many countries in the West have gone the way of incentives, to try and get more people to get vaccinated. I'm not sure, but I don't think Singapore has gone that way yet, because I think maybe the government simply doesn't feel the need because the compliance is very, very good. Booster shots, another controversial issue. My own view is, once again, there is an ethical issue here. Why should you be wasting vaccine doses when the large majority of the global population, especially in developing countries, have not even received the first shot? Africa, for example, less than 3% of the population have been fully vaccinated. And I actually have not seen much evidence to say that a booster, the third dose, is actually necessary. However, I believe that there could be good reason to give a booster for those who are vulnerable. The elderly, especially those with underlying conditions like diabetes, heart disease, a whole range of other, high blood pressure, for example, obesity. So there could be a justification in that vulnerable group. But overall, I have not seen much evidence to say that it really is necessary. Once again, you got to balance, the ethical, legal, moral issue as opposed to sort of protecting the vulnerable group.
Some big questions ahead. Thank you as always, Professor Tiki Pangestu, visiting professor at the Yong Loo Lin School of Medicine at NUS.